one of my current grants is called Food is Medicine across Kansas. And one of the clinics that we work with, which is out in western Kansas, Sheridan County, they are part of the Food is Medicine grant opportunity. And so they wanted to really expand their reach, and they decided to apply for the USDA Produce Prescription Grant. They decided to, they reached out and asked me if I would be the evaluation principal investigator on it, and I said yes, absolutely, because I've seen what they've been able to do with their Food is Medicine grant, and I think the possibilities are endless for them as well to be able to expand on this grant opportunity as well. We are really excited about this grant. Honestly, I was asked to be a part of two different produce prescription grants as the evaluation specialist. I never thought in a million years, honestly, that Sheridan County would get this grant. I figured it would be the other one, and in fact, it surprised me because Sheridan County got it, whereas the other clinic that applied did not. This is a really exciting opportunity. I believe this is the first ever produce prescription grant that really does two things. First, it focuses on a frontier geographic region. If you don't know what a frontier geographic region is, that means there's less than 6 people per square mile that live within that area. So this grant focuses on a 3-county region. It's a frontier geographic region. That means that resources and healthcare access and availability is really sparse. We think of frontier and rural regions having rich farmland, and while they do, the focus is on monocrops, and so they don't get the rich fresh fruits and vegetables. This is a way that they can tap into maybe some of their local resources, as well as thinking about community-wide efforts to bring fresh produce to their community. A second really exciting thing about this grant that USDA has not focused on or funded yet is that this is really geared towards kids. So the target age group is 5 to 18, and the focus is trying to prevent chronic diet-related chronic diseases at that age level, where maybe we can have an impact on diet and health and exercise, so that it follows them lifelong instead of having to treat it like many of their parents and grandparents that live in that community, where we're treating them now for diet-related chronic diseases. So it's a way to be able to teach healthy eating. Even though it's geared towards kids, the children will get fresh produce that's really available at the family level, so everybody can partake in it. And it's also a way for them to be able to engage more with healthcare. And what I mean by that is a lot of these children aren't getting their annual exams. This is a way that we hope to create trust and foster relationships with healthcare and community members. So not only are they getting fresh produce, they are also being encouraged to take part in nutrition education and to develop relationships with healthcare staff, so that hopefully quality of life indicators continue to go up. So I'll be evaluating different aspects of this grant, just how much dose of produce that they're getting, how much they're actually eating, and if this is making a difference on things like maintaining a healthy weight, maybe reducing the possibility of them developing things like prediabetes, high blood pressure, type 2 diabetes. So we're really going to be tracking some of those health measures, as well as, are they eating these produce items that they're being provided? Is it making a difference with family health? Within these areas as well, there's high rates of food insecurity. So we're also looking at, does food security status change as a result of their involvement with the program, and does their trust of healthcare staff also improve because of some of these more meaningful relationships that are hopefully being fostered as a part of this program. Yeah, I always like to say I like to get my students boots on the ground. It's the same for me. I'm a community health person. Even though it's not a beach, I'm not going to a beach, I get to go to western Kansas, and I get to be with the people. This is an amazing opportunity, and I'm really excited about working with these children, working with the families, and just seeing what kind of outcomes occur because of this program. So it's an exciting opportunity that I'm really happy to get started on. This is something that I think our students can learn a lot about. These are unique grant opportunities. We don't know how much longer they'll be around. Who knows how long they'll be in the Farm Bill, but while they're there, we need to take advantage of them. And this presents just a phenomenal learning opportunity. It's something that I would have loved to have taken part of as a grad student or an undergrad student. And I know we have students that are interested in this area. So this presents a great learning opportunity for our students as well. We're looking certainly at feasibility, but there are outcomes that we have to track. So we do have to track consumption of fresh fruits and vegetables, some health indicators like body mass index, so height and weight, as well as just tracking any type of chronic diseases that might occur. We typically don't see diet-related chronic diseases in young children, but if we can prevent that as they grow older and start to make more food-related decisions, that's something that we're going to be looking at as well. And we certainly want to look at and we want to monitor and see if food insecurity, that status of moving from food insecure to food secure, we want to see and address if that occurs as well because of this program. So this grant will run over the next 3 years. It officially started August 1st. We are in the planning stages of it. It is a three-year $500,000 grant through USDA. And so the program itself, we're 6 months planning, and then we have 2 years of intervention period, and then 6 months of data crunching, really looking to see what the data is telling us. So we are going to be busy for the next 3 years. What I'm excited about is when we think of food as medicine and produce prescriptions, they take place in large urban areas. And so what is really exciting, I cannot emphasize this enough, is how the focus is on a frontier and rural geographic region with the focus being on children. This is a very unique opportunity that we are really looking forward to see what comes of it.